Retinal detachment is a condition that can have very serious effect on the vision. The reason why most retinal detachments occur start out with a very normal process of the eye. The retina, as you can see from my model here, is like the wallpaper lining in the back of the eye. Has millions of light receptor cells which allow you to see, and in order for it to work properly, it has to be lining the back wall of the eye. What happens is that the gel that's in the center of the eye, called the vitreous, changes as we age. And when we're born, it fills this cavity in the middle of the eye completely. And it's very strongly naturally glued to the front part of the eye, and it's less strongly glued to the retina. And over time, with age, the gel starts to change. It starts to shrink, it starts to liquefy, and one day, the gel is just not large enough to fill this whole space anymore, and one day it just suddenly pops off the back wall of the eye. And that's a normal thing. It happens on average when we're about 60 years old. But occasionally, as it pops off, it can pull on parts of the retina, leading to a tear in the retina. It's just like a tear in the wallpaper in the wall of the eye. And when that happens, fluid from the middle of the eye can go through the tear in the retina underneath, and the retina can start to peel off the wall of the eye, just like wallpaper coming off the wall. If that happens, that's a very serious problem and can lead to very serious vision loss, and is something that requires very prompt surgery. Some of the symptoms that a person may have when this is occurring is they may notice a sudden new shower of black floaters in their vision, little spots. Additionally, they may notice that if they're walking around in a dark space, they turn their head, they may have some bright flashes of light which aren't really there. When a retinal detachment occurs, it causes loss of vision in the area of the retinal detachment. A patient may notice a curtain that's dark or looks like water moving in towards the center of the vision. And so if you ever have any symptoms like that, that's something to call us right away.